Well, we've of course had the Kent variant has been the thing that's really caused us to go into quite a severe lockdown over the Christmas period. So we have been living with a variant that has certainly is now becoming more common across Europe. But we're also there are also other variants of what are called variants of concern. Particularly variants, the South African variant, which is increasing, and also what's called the P1 variant. And this is the variant that was detected in Manaus in Brazil. And if you remember, a few weeks ago we had a kind of manhunt for the sixth person of 6 cases. And now we're seeing, actually, we have 27 detected cases of the P1 variant. So that's increasing, well, it's doubled in the last week. So this is why I think the government wants to include that 4th test, that variance test. So we are seeing variants, and we obviously have to take those very seriously, because if we do come out of lockdown, the last thing that anybody wants is yet another lockdown.
Unfortunately not. I don't think it will. I think one of the major problems is this asymptomatic transmission. So it hides itself so well, and often it's transmitted before you even develop symptoms, or you may not develop symptoms at all. So that's going to make it really, really hard. It does mutate. I think we will learn to live with it like we live with seasonal flu. I think we're going to have to continually vaccinate each year, just like we do with seasonal flu. But I think I don't ever see us getting a zero COVID situation. I really don't. Until COVID happened, the number of deaths from seasonal flu each year wasn't in the public consciousness. And there can be 20 to 30,000 deaths from flu in a bad year. And that is just something that people don't ever really think about. I know that when I present this in lectures, people are like, oh really? And it tends to affect the people who are in the 70s and over, and the hospital admissions are really, really high. Now, there's not been much seasonal flu this year because of COVID. Perhaps also there's not been so much seasonal flu because of the social distancing and all the hygiene aspects that we've taken. And I think it's just going to become like that. I think, unfortunately, it's going to be one of those illnesses that comes into the group of respiratory illnesses that unfortunately lead to death in vulnerable people over the winter period.
COVID-19 will spread in the cold and the heat equally. What COVID-19 won't do is it won't spread with strong ultraviolet light, so sunshine. So it's very fragile when it comes to that kind of disinfectant. So when it's warm outside and the sun is shining, then the virus won't survive as long on surfaces or in the air in the presence of ultraviolet light. In the dark, in gloomy, cool conditions, it's going to survive much longer. But out in the sunshine, it's going to denature and degrade very fast.
So getting the vaccine is not actually going to stop you from getting infected. It's unlikely to stop you from getting infected. Why the vaccine works is it stops you from shedding so much virus. So once you've been infected with a virus, and particularly with coronavirus, what it does is it targets your airway epithelial cells. So all the epithelial cells, the particular cell type that line your nose and your throat and all the way down into your lungs, that's what your coronavirus will infect. So once a cell has been infected, the virus can then divide and multiply itself, and then it buds off from infected cells, and then you've got lots more virus particles that are available to then infect other cells nearby. When you have been vaccinated, the vaccine will hopefully, what it does is it primes your immune response to kill off any virus infected cells and any particles and use antibodies to neutralize any particles of virus. So if you've been vaccinated and then you get infected with the virus again, this time you're going to make an immune response much more quickly, and therefore it will neutralize the virus, so you won't shed so much virus, which means you won't spread so much virus. And in fact, it can reduce your virus spread to very, very, very low levels. So yes, definitely do have the vaccine. Even if you've had COVID before, it can still prevent you from making and shedding more virus and infecting other people.
I think it will affect students. again, it depends what they're graduating in. I think there will be some jobs, and we already know that there are some jobs that have had to make redundancies and cutbacks because of the pandemic, and so we can't shy away from that issue when we're looking at that impact for our students who are going to be graduating. Having said that, we are also aware that there are other markets that have flourished during the pandemic, largely because we're all remote, and so online sales have gone up, and we know that, and some new products have come onto the market to try and address the pandemic. So things like masks, etc. Those sorts of services. Wellbeing services is a big area that's growing, both in terms of jobs within companies, so looking after the well-being of staff, but also well-being services for the general public. So I think, yes, there will be an impact on graduation, but at the same time, I think students need to kind of look outside the box and look at the new avenues where new jobs are being created and will be created in the next year or so, and there will be opportunities for them to do that.
We are starting to see increases in the case numbers in children, and we've seen in the past that cases start in younger people and then move up the age groups. And of course, if there are cases in schools, then it's possible that those school children will go home and potentially infect their parents. And the risk is, as more and more things become unlocked, there's more potential for different groups to mix and for more transmission to happen. So it's very possible there will be a further wave, but further wave in cases. And of course, one good thing about COVID, if there is a good thing, is that the severity amongst children is relatively low. But what we don't want to see is that going through to the vulnerable groups. So the older people potentially, but also people who may be vulnerable by having clinical conditions that haven't yet received the vaccine.
The accuracy of lateral flow tests, or any test, is really important to understand. If you get a positive reading on a lateral flow test, you have the virus inside you. No doubt about it. You can be very confident that you are carrying the virus, you have the virus inside you. If you get a negative test, that does not mean you don't have the virus. It means that the virus has not been detected. And there are several reasons why you could have the virus and still not test positive, depending on how you took the sample when you stuck your stick inside your head and scraped around. Did you actually scrape the right piece of tissue that had virus in it? Or maybe you've only recently been infected and the disease hasn't developed yet, so there isn't enough virus for you to sample and test. And finally, maybe the chemicals or the tests that you were using were faulty, and you sampled, everything was fine, the virus was there, but the test didn't work properly. The lateral flow test fails to danger. So if you get a false negative reading, you are a very dangerous person if you behave as if you haven't got the virus. You have to behave as if you may have the virus. And small things that you do, like wear a mask, don't get too close to people, maintain good biosecurity, could save someone's life. You'd never know. But small actions have huge consequences in this disease. So if you test negative, doesn't mean you're safe. It means that you should be careful. If you test positive, you have the virus. You need to take precautions and follow the guidelines.
Based on what we've seen with other respiratory illnesses, we would suggest that you take it easy. Your immune system will be incredibly vulnerable. It's taken a huge hit, and the COVID infection causes massive disturbances in your immune system, which seem to persist even after you've stopped having your symptoms. So because of that, using exercise as a way to rehabilitate, you need to take it slowly, be very aware of your fatigue levels, and that's the way we've seen it with other respiratory illnesses, and we think that will be something similar. But obviously COVID's thrown up so many new things anyway, so it might be something that takes a bit longer in COVID than it has done in, say, something like seasonal flu.
One of the things about the pandemic is there's been a much greater focus on mental health. And motivationally speaking, in terms of exercise, that's a really good thing. Because if you exercise to improve your mental health, that's a really strong attachment between the action, the exercise, and the goal to improve your mental health. Because when you exercise, you're very likely to feel better straight away. And so those good feelings and increased mental health get attached to the activity, and that becomes very powerful. And actually, motivationally speaking, that's a better bet than exercising for physical health. Because if you are exercising, going for a run, for example, to get fitter down the line, you don't really get fitter and you don't improve your health to much longer in the long term. And so they're quite detached, the exercise and the goal. And so that's motivationally not as powerful. So actually, exercising for your mental health, which we're all encouraged to do during the pandemic, is also a better bet, motivationally speaking, to help you sustain those exercise routines and behaviors. So if I had to put a bet on one, mental health, physical health, I would advise putting your money behind exercising for mental health to help you sustain those exercise behaviors in the long run.
The first is to preserve your sleep habits, and importantly to preserve a getting up time each morning and not to spend too much time in bed. That's the first thing. The second thing is unique to lockdown. One of the things that lockdown has afforded is an opportunity to be quite flexible with our behaviors. If you're not sleeping terribly well, try to avoid napping during the day, even though it's easier now than it's probably ever been for many of us. Okay, if you avoid napping during the day, you preserve sleepiness until bedtime. And if you have a sleep problem, sleepiness is a precious resource. Don't squander it napping during the day. And the third thing is, if you're managing your workload at home, try and maintain boundaries between work-related issues and home-related issues. Stop working at a time when you can place a buffer between the end of your work period and the beginning of your home life period. Separate these two things and don't merge them in a way that demands that you take work-related thoughts more so than you usually would to your bed. 3 good points.
The problem with COVID-19 vaccine hesitancy is that it's tied up with all kinds of really big fears and anxieties that the public has gone through since the pandemic began. So one of the important things that I've been working on in relation to vaccine hesitancy is how do we provide people with the information that they need to endorse positively the vaccines in their online social networks, to reach the news avoiders, the people who say that they don't really actively follow the news about COVID, but of course they also say that they're likely to go online and discourage others. What we suggest is that direct forms of contact are actually more useful for government and public health messaging. So what would be a better bet really for these people is to send direct mail, post, in other words, letters, or to contact people by phone. And we know, for instance, that so-called anti-vaxxer, anti-vaccination activists are highly organized online, particularly on social media. So we suggest that one of the main aims to kind of counteract the influence of anti-vaxxer networks, which are entirely unfounded beliefs about the safety and efficacy of vaccines, of course. What we need to do is to provide people with a reason for browsing away from their social media environment. So what we've got to realize is that it's just as important to give people who are positive about vaccines good things to share. So it's important, therefore, to provide this information in social media settings, not only because some people who are doubtful about taking the vaccine might
hopefully click onto a government or a public health website, an NHS website. But it's also important to empower those who are positive to share this material in their personal networks online. So it's a rather complicated set of recommendations that add up to solving this particular communication problem.
You know, we have a prison system at the moment which has around about, I think, 77,000 people in it. Before the pandemic, we were looking at probably about 83,000. Now that in itself is that the prison population has eased as a result of the backlog of cases going through the courts. So less people are being processed through the court system and therefore ending up in prison. But we've also seen the benefits of having a slightly reduced prison population, not just in terms of COVID specifically, but we can think about it in terms of communicable diseases across the board. The more we're able to spread people out, the more space we're able to provide. That reduces those instances of communicable diseases, whether it's COVID or flu or whatever it might be. So there are definite benefits to having a smaller prison population, and that's going to be the case as well when rehabilitative efforts start returning to prisons as well. The fewer people you have in a prison, the easier it is to be able to engage those people in a range of different rehabilitative activities. So I think that's probably the biggest thing that we should look at there, is what this reduced prison population has done, not just in terms of preventing the spread of COVID, but what it can do moving forwards. And maybe we should start thinking about putting less people in prison who don't really need to be there.
I think the whole support thing does need to be looked at. I think it will be a very different way of ensuring that employees are productive and healthy whilst they're working from home. And of course, we know that in the workplace, risk assessments are done to ensure that an individual's working environment isn't going to be detrimental to health. And that still needs to be worked out by employees, how, to what extent they will be able to do that for somebody who's working from home, and what's the implication for equipment, for chairs, for desks, etc. But also a lot of the health and wellbeing initiatives that are rolled out in workplaces will need to be a rethink as to how can this be delivered remotely without losing the essence of what it is that they're trying to do.